Hello friends. So today we will be studying histamine. So histamine is a type of otacoid, and by otacoid we mean auto means self and alkos means remedy. So otacoids are the local hormones. So the otacoids, they may be either amine derived, lipid derived or peptide derived. So amine derived otacoids are histamine, serotonin. Lipid derived otacoids are prostaglandins, leukotrienes, platelet activating factor. Peptide-derived otacoids are bradykinin, calidin, and angiotensin. So coming to the histamine. Coming to histamine. So histamine is an inflammatory mediator. Now histamine receptors, what are the receptors? They are H1 receptors, H2 receptors, H3 receptors. So H1 receptors, it is GQ coupled. H2 receptor is GS coupled and H3 receptor is GI coupled. All the three receptors are GPCR, that is G protein coupled receptors. So H1 receptors, this is responsible for the vasodilation in the blood vessels, bronchoconstriction, and triple response. In the CNS, it is also responsible for wakefulness. Coming to the H2 receptors, it is present in the parietal cells of the stomach. Present in the parietal cells of stomach, and it is responsible for HCl secretion. The third receptor, that is the H3 receptors, it is a presynaptic receptor, and its effect is just like the brake. You can correlate this as the same effect of that alpha 2 receptors, which are present presynaptically and they act as brake in the adrenergic system. Now coming to the H1 receptor agonist. Agonist at H1 receptor is beta histidine. So it causes vasodilation in the inner ear and it has been shown to decrease vertigo, particularly in Meniere's disease. Now, where it is contraindicated? As because it is the H1 receptor agonist, it must be contraindicated in asthma. For example, this is the synapse, and presynaptically, these H3 receptors are located. For example, if this is the synapse, and here the H3 receptors are located presynaptically, and the H1 receptors are present here. So the H1 is responsible for the wakefulness, whereas the H3 receptors, this act as brake. So what will they do? They will decrease the histamine release. So if we are to increase the wakefulness, we have to give H3 inverse agonist. Yes. So what are these H3 inverse agonists? These are pitolisant and tiprolisant. And what is their use? They are used in narcolepsy. Okay, so pitolisant, tiprolisant, these are H3 inverse agonists which are used in narcolepsy. Which is the other drug which is used in narcolepsy? It is modafinil. Okay, modafinil we will discuss when we will be discussing CNS. Next, coming to antihistaminic drugs. So this can be H1 receptor blocker or they can be H2 receptor blocker. This H2 receptor blockers we'll be discussing when we'll be discussing the drugs used in peptic ulcer disease. Okay. So for now we will discuss antihistaminics as H1 receptor blockers. So the H1 receptor blockers, they are of two types. Very difficult to remember. First generation, second generation. Okay. So H1 receptor blockers, they are divided into first generation and second generation. So this first generation, these cross the blood-brain barrier. The second generation, definitely they will do not cross the blood-brain barrier. And that is what is the advantage of the second generation. Okay. So as these cross the blood-brain barrier, they will cause sedation as adverse effect. Whereas the second generation, as because they do not cross the blood-brain barrier, they do not cause sedation as the adverse effect. The first generation blockers, they have additional anticholinergic property. Whereas the second generation blockers, they do not have anticholinergic property. So coming to the first generation antihistaminics, and by antihistaminics, I mean the H1 receptor blockers. Okay. So the first generation antihistaminic, the drugs are diphenhydramine, dimenhydrinate, promethazine. So these are the drugs, this diphenhydramine, dimenhydrinate, and promethazine. These have high anticholinergic property. And this anticholinergic property is maximum with promethazine. Okay. So these drugs, these are used when we require anticholinergic effect. Okay. So these are used in drug-induced acute dystonia or drug-induced Parkinson's disease, Parkinson's symptoms, sorry. So they are used in drug-induced Parkinson's symptoms. Okay. Apart from that, this promethazine, it is also used in motion sickness. Other drugs which are used in motion sickness are meclizine, buclizine, another drug is there which is also used in the vomiting in pregnancy, that is doxylamine. Okay, and this doxylamine is combined with pyridoxine and it is the drug of choice for morning sickness. And what is this morning sickness? It is the first trimester, nausea and vomiting. Okay. Apart from this, there are certain other drugs in first generation antihistaminics. They are pheniramine, chlorpheniramine. So these are used in treatment of allergy. Chlorpheniramine is present in cough and cold preparations. Apart from this, we have the hydroxyzine. Okay, it is used in the treatment of pruritus. Okay, Another TCA is also there, which has got some antihistaminic property and is used in pruritus, and that is doxepin. It is a tricyclic antidepressant used in pruritus for its antihistaminic property. Second, coming to second generation antihistaminics. Okay, so in the second generation antihistaminics, as we have already discussed, they do not cross the blood-brain barrier and there is no sedation. So where this drugs can be used, this can be used in the persons where we have to avoid the sedations, like someone who is doing driving. Okay, so in those cases, you can give second generation antihistamine. So the drugs are terfenadine, estemizole, estemazole, and ibastine. These were the drugs which were used previously, terfenadine, estemizole. They have been banned from uses. Why these have been banned? Because all these drugs, they were known to cause QT prolongation in the ECG. Okay. Now, this terfenadine, it is metabolized to form fexofenadine. Fexofenadine in the body, and this fexofenadine, it does not cause QT prolongation. Okay. Now there are certain other drugs which are cetirizine, commonly used, levocetirizine. Now you can ask me a question, when there was already cetirizine, why do we have levocetirizine? So the advantage of levocetirizine is that it requires a lesser dose than cetirizine for its action. Apart from that, we have other drugs like loratadine, which is converted into a metabolite, which is desloratadine. And this is an example of a drug where active drug is converted into active metabolite. And both can be used as drugs. Another drug we have, that is rupatadine. This rupatadine has got anti-platelet activating factor property. Okay. Now, apart from this, there are certain topical antihistaminics are also there, which are second generation, and they are agelastin and olopatadine. This olopatadine is available as eye drops. Okay. So this was all about the first generation and second generation antihistaminics. By antihistaminics, we mean H1 receptor blockers. So coming to the receptors, the location of the receptor of histamine and the actions and what are the various drugs in one single table. So H1 receptors, they are present in the CNS and in the bronchus. So they cause allergy, stimulate reticular activating system, and promote wakefulness. These are GQ coupled. And what are the drugs which are targeted in this? First and second generation antihistaminics, H1 receptor blockers. Okay. H2, it is present in the stomach. It secretes acid, HCl. It is GS coupled. And what are the drugs? H2 receptor blocker. These are ranitidine, cimetidine, famotidine, etc. Coming to H3 receptor, it is present presynaptically, and this acts as brake just like the alpha 2 receptors of the adrenergic system. And the drugs which are targeted at these are S3 inverse agonist. What are the drugs? These are tiprolicant and pitolisant, used for narcolepsy. Then H4 present in the WBC, helps in the chemotaxis. Okay, so this was all about histamine. Thank you.